Good morning. I'm very happy that we have 1,000 subscribers with us now. Thank you all for subscribing to this educational channel. We are committed to providing you quality educational EUS videos from Ideal Care and School of EUS. 1,000 is a big number as far as EUS enthusiasts go. And so I am very, very happy that in a short period of time, we have a very, very big team of EUS enthusiasts who are participating, watching our videos, giving comments. So thank you very much. Today, to celebrate this, we will do a short video. This video is basically to tell you how to take the assistance of EUS in cricopharyngeal intubation. So normally the intubation is done with the help of endoscope, and we don't use EUS. We usually start looking at the EUS from about, let us say, 21, 22 centimeters in the esophagus. While that is okay, sometimes you may find that it is difficult to intubate the cricopharynx, especially in obese patients or patients with a thick neck. And sometimes you would need information of lymph nodes in the neck, lymph nodes in station 1, station 2. And so it's a good idea to start practicing the introduction of echoendoscope under EUS guidance. So we keep both endoscopy view as well as echoendoscope view, and we take the help of EUS, and we believe that this also prevents the happening of accidents like perforations, because you are going under complete ultrasound vision. So I will show you how you do it. We are using the linear echoendoscope. I have placed a balloon for clarity of images because, as you know, there is a lot of air in this area. However, once you become little experienced in it, you will probably not need the balloon. So let us start. You can see on the endoscopy picture that I am outside the patient's mouth, and then we are starting the introduction. You see, as soon as we introduce, you see the tongue. It's a heterogeneous structure here, and here you see an air column. This is the oropharynx. So this is the oropharynx, and this is the tongue. From here, you start using your up control. So depress the tongue using the up control, and you start seeing an air column here. See this? So now here we have the tongue this side. We have the posterior pharyngeal wall. We are seeing the posterior pharyngeal wall here. Now, you should use your up angulation enough. If you do not use your up angulation enough, your echoendoscope will hit the posterior pharyngeal wall and you will find resistance. This air column guides you how much up control you have to do. So just follow the air column here. When you follow the air column, use the up control so that you are following the air column and go millimeter by millimeter. Here you are seeing the cervical spine here. So we see the cervical spine, and then we gently go down till we see a hyperechoic white area. This is the hyperechoic white area. This is the arytenoid cartilage. So this arytenoid cartilage, as you know, is a landmark for us because we go behind the arytenoid cartilage to enter the cricopharynx. So once we see this arytenoid cartilage, we gently push a millimeter and you will start seeing the thyroid. See this? This is the thyroid. We are still not entered the esophagus, mind you. So we have entered the thyroid, we are at the cricopharynx. We're gently pushing our probe to see the thyroid. And once you see the thyroid, all you have to do is turn a little clockwise and put a gentle pressure, gentle squeeze, inside squeeze to the echoendoscope, and you will go in. Uh, Use your movements millimeter by millimeter. So don't use very heavy movements. Please remember this is, you have to be careful here. So now you are seeing the common carotid, sternocleidomastoid. Here you can see lymph nodes also. So cervical lymph nodes can be seen in this area. If I push my echoendoscope a millimeter more, now this is the anterior side, you see this long hyper echoic linear area, and you know what it is. It is a thyroid cartilage. So you are seeing the thyroid cartilage. You push a little more, you will see the trachea. So this is the anterior wall of the esophagus, and we are seeing the thyroid cartilage. And if you push a little more, you will see uh, the trachea itself. Now, here you can see the neck vessels. We can see the station 1 and station 2 also before we start our real examination. Examining the stations is important, especially in patients where you have a lot of lymph nodes, patients with lung cancer. So now what I'm doing is I'm turning my scope a little anti-clockwise, very little anti-clockwise, and start seeing the aorta and the common carotid artery coming out on the left side. So anti-clockwise means left of our body. And then you come back to the trachea and turn a little clockwise. When you turn a little clockwise, you will see another big vessel going into the neck, that is the brachiocephalic artery. So you see here, you will see, of course, you have to do little maneuvers, millimeter by millimeter, and you see this is the brachiocephalic artery, which is dividing into right common carotid artery and the right subclavian artery. So right and left. You see here common carotid artery you saw, and then you saw the brachiocephalic artery. And so here you have all the important vessels. You have the thyroid cartilage and you have the trachea. And you can see lymph nodes of station 1, station 2. In another video, I will show you actually how we see those lymph nodes. But this video was primarily to make you familiar with how to take the help of echoendoscope for negotiating the cricopharynx and the cervical area. Thank you.